Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us here on Health Professional Radio. In this segment, we're going to be speaking with Dr. Shannon Westin. She's joining us here to discuss low-grade serous ovarian cancer, or LGSOC, which impacts younger women compared to other forms of ovarian cancer. Welcome to Health Professional Radio, Dr. Westin. Thank you for taking the time this evening.
Oh, thank you so much for having me. I'm excited to be here.
Well, give us a bit of insight into your area of expertise and tell us all where you are practicing currently.
Sure. So I'm a gynecologic oncologist, which means a surgeon who also gives chemotherapy and takes care of women with gynecologic malignancies, including ovarian cancer, endometrial cancer, cervical cancer, and others. I currently am a professor at the University of Texas MD Anderson Cancer Center in the Division of Gynecology Oncology and Reproductive Medicine.
Low-grade serous ovarian cancer. I understand it's a rare type of ovarian cancer. It disproportionately affects younger women. Is that the only thing that differentiates it from other cancers?
Sure. Well, I think first I want to level set, ovarian cancer itself is a rare tumor overall, affecting about 1 in 72 women. What we see is the predominant cell type of ovarian cancer is called epithelial. And when we look at epithelial, we see high-grade serous is the highest proportion, about 80, almost 90%. Low-grade has a smaller proportion of women overall with ovarian cancer. And what we see actually is, as you mentioned, is it certainly does seem to predominantly involve younger women. Mm-hmm. It also tends to be slower growing, more indolent, and not quite as responsive to chemotherapy as some of the other ovarian cancer cell types.
Is it harder to diagnose than other types of ovarian cancer?
Well, I think the tricky thing about ovarian cancer in general is that the symptoms are often very nondescript, and so women are often diagnosed at later stages. But as far as making the diagnosis when we have someone in our clinic and getting a biopsy to get the right answer, that's something that can be done in a very straightforward fashion by a person with expertise in pathology.
Is it harder to treat than other types, or is it relatively the same approach?
Yeah, I think this is a great point. We used to treat this entity just the same as we treated every other ovarian cancer, and that was the problem. So when we were doing that, it was hard to treat. Now we've learned a lot more about these tumors molecularly, and we see that they're hormonally driven, and they also have quite a few aberrations in survival pathways like RAS and RAS. And so now that we're starting to treat them as their own entity, we're actually getting a lot better results and finding it easier to treat them.
Back to the diagnosis question. Are there certain questions that women should be asking, or are there certain questions that physicians should be asking when they're told about certain symptoms?
Yeah, this is an awesome point. I think, we've often heard of this idea of ovarian cancer as a silent killer, and that's just not true. We know that women have a number of symptoms prior to their diagnosis of ovarian cancer, but it's just awfully subtle. And that can be even more so in younger women where we see low-grade serous. They have abdominal pain or bloating. It's blown off to being part of their menstrual cycle, or maybe they're lactose intolerant. And so really, what we try to empower women with is if you're having abnormal symptoms like bloating, abdominal pain, feeling full, and those types of things, to ask your doctor for a workup, even if you're younger. Now, it's important to note that these things, if it's just a passing side of adverse event, such as a passing symptom, that's okay. You're likely okay. Maybe it's something you ate. But if it's persistent beyond 2 to 3 weeks, that is enough to warrant a good workup.
Is the mindset that a woman is too young to have ovarian cancer, is that something that is a barrier to accurate diagnosis?
Absolutely. I mean, I think, we see this with people just attributing young women's symptoms to other things and not thinking, well, this woman could have ovarian cancer, because in general, most ovarian cancers are diagnosed at later ages, at ages of 60 and 70. And so people don't necessarily think of ovarian cancer when they have a young woman in front of them.
So what are some of the red flags that a physician should be looking for? What are some of the things that a woman says, hey, this is happening, and then regardless of her age, just, throw out the mindset and say, hey, I need to test for this, that, or the other thing?
Yeah, I mean, I think that if you've got a woman with chronic abdominal symptoms that are out of proportion with exam and not really attributable to something else, those are reasons to do a workup. And the workup is fairly straightforward. So the things that I would look for are abdominal pain, bloating, nausea, feeling full early, clothes not fitting, weight gain that is unexpected based on, what her current diet is. Those kind of things should prompt a workup. And frankly, the workup can start off pretty straightforward. A transvaginal ultrasound, checking a CA-125 level. Those are fairly straightforward and simple things that can be done and can be utilized.
Do you find, or have you heard, that it's more on the part of the patients themselves thinking that, I must be too young, it couldn't possibly be ovarian cancer, or is it on the side of the physicians who are kind of, set in their ways when it comes to diagnosing ovarian cancer?
I think it's a little bit of both. I think definitely it's on the physician side where, we see, go get a GI workup or, change your diet or, do these things. And so they're not necessarily thinking of ovarian cancer for those younger women. And then frankly, I would say from the patient side, people maybe aren't as aware of ovarian cancer. We hear a lot about breast cancer and other cancer types. And so sometimes women just simply don't even know what the side effects and symptoms are of ovarian cancer. And so young or not, they just don't know what to look for.
What do you think is needed to get the word out about the nature of LGSOC?
Yeah, I mean, I think things like this, reaching people where they are and helping not only educate providers so that they're aware, but also educating patients however we can, so that they can really own their health. I think there's a lot of organizations like the Gynecologic Cancer Foundation and others that are really trying to get that word out, get information out so that women are aware and can really own their own health.
Is it possible that it's such a rare form that funding isn't readily available? And since there are no screening tests or prevention methods right now, I guess getting the word out is the best thing that we can do.
Yeah, I mean, I think, from a funding standpoint, we are seeing an increase in interest in funding research on rare tumors. So that's a positive. We're seeing a movement away. We typically see quite a bit of research dollars going towards the most common cancers, which obviously are very important. But we are now seeing organizations that are specifically interested in funding some of the more rare tumor types. And so that should benefit us. But in the meantime, it really is on us in the community to get the word out the best way we can.
Now, we were talking about how some of the symptoms can be overlooked for other factors than just a woman's age, but overlooked nevertheless. I understand that there's a way that you can check your symptoms online. Is that correct?
Yeah, there's some really interesting online options. We have been looking into one specific one called Step Up America for Ovarian Cancer, and they have an online symptom checker. It's really cool, and so I have a website if you want to hear it.
Absolutely.
Okay, so it's www.staroc.org/symptoms. And they can use that to basically keep track of their symptoms and determine if there's something of concern.
Dr. Westin, I appreciate your time this evening. Thank you so much for joining us here on Health Professional Radio, and hopefully you'll come back.
I would love to, anytime.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Shannon Westin. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.